Across the United States, the opioid epidemic has affected hundreds of thousands of lives, taken hundreds of thousands of lives, and affected even more families. The impact of this epidemic is most visible in smaller communities. In smaller cities like Cumberland, this crisis is not abstract. It affects families, neighbors, co-workers, and even entire communities. This is not only a national issue, it is a local one, and it demands a local response. Our help. The opioid crisis has had a measurable and devastating impact on Allegheny County. According to state data, there were 48 fatal overdoses in Allegheny County in 2023, followed by 22 deaths in 2024. A significant decline, but still a serious loss of life in a county of only about 66,000 people. Even more concerning, Allegheny County had one of the highest overdose rates in the entire state, about 69.9 deaths per 100,000 people. According to the CDC and Maryland Matters data, overdose deaths in Maryland have dropped by nearly 30% from 2023 to 2024. While recent numbers show improvement, experts emphasize that the crisis is far from over. Across Maryland, there were still 1,700 overdose deaths in 2024, with opioids, especially fentanyl, remaining the primary driver. What makes this issue especially urgent is not just the number of deaths, but the barriers to prevention and treatment. Limited access to recovery services in rural areas, transportation challenges for those seeking treatment, and ongoing stigma surrounding addiction. Local agencies such as the Allegheny County Health Department continue to respond, but resources remain limited relative to the need. The reality is this: progress has been made, but the crisis is still present and preventable deaths are still occurring. Addressing this issue requires practical, community-level solutions, not just awareness. I propose expanding local prevention, response, and recovery efforts through 3 key actions. Increase community-wide overdose prevention training, training residents, educators, and community members to recognize and respond to overdoses, especially through the use of naloxone. Therefore, they can save lives immediately. According to the CDC, increased access to naloxone, Narcan, has been a key factor in reducing overdose deaths nationwide. Strengthen partnerships with state and local health organizations. Collaborating with agencies like Maryland Behavioral Health Administration can bring more treatment resources, recovery programs, and even outreach initiatives directly into our community. Expand early intervention and education programs. Effective prevention starts way before addiction even develops. Community education efforts should focus on substance misuse awareness, mental health support, and reducing the stigma surrounding addiction. These solutions are realistic, scalable, and already proven to reduce overdose deaths when implemented consistently. If these solutions are expanded and supported, the impact could be significant. We could see continued reduction in overdose deaths, greater access to treatment and recovery, and even stronger, more informed communities. In fact, the recent 54% decrease in overdose deaths in Allegheny County from 2023 to 2024 suggests that targeted efforts already work and can work even better if expanded. But if the action is not sustained, progress could reverse, more lives can and will be lost, and the burden on families and healthcare systems can and will grow. The direction this community takes depends on whether current efforts are strengthened or allowed to stall. Our choice. The opioid crisis in Cumberland is not unsolvable, but it does require continued commitment. Supporting funding for prevention programs is crucial. Community members should participate in overdose response training and naloxone, Narcan training. People need to continue to advocate for expanded treatment access, because even one preventable death is too many, and the data shows that the action works. Thank you.